Welcome to This Explainer. Today, we're zeroing in on a massive part of women's wellness that honestly just doesn't get the airtime it deserves, right? We're talking about menopausal sexual health. More specifically, easing painful sex during menopause. Okay, let's jump right in because we're going to unpack exactly why this happens, look at the literal anatomy behind it, and, spoiler alert, show you why this is a completely, absolutely treatable condition. Now, if you're watching this, you might have experienced a really deep, familiar kind of frustration. So many women who seek help for painful sex during or even after menopause are just casually dismissed. You know the drill. You might have been told your pain is just in your head, or that it's a normal part of aging, or, my personal favorite, just part of being a woman. Look, if you've heard those words, know right now that you were given totally incomplete information. I really want to start by strongly validating your experience here. Your pelvic pain is real, period. It is absolutely not in your head, and there are solid evidence-based treatments that actually help. This entire explainer draws directly from the clinical expertise over at OVA Women's Health. These guys are specialists who truly get that chronic pelvic pain needs targeted, compassionate care. They literally built their entire practice around providing the exact kind of validation and treatment you've probably been searching for. Okay, let's move into section 1, why menopause hurts, the biological shift. To fix the problem, we kind of need to understand the why behind it first, right? So it starts with a massive biological shift. Clinically, menopause is just defined as the point when 12 straight months have passed without a period. Simple enough. But under the hood, what's really happening is this huge, significant decline in your estrogen and progesterone. And this isn't just about reproduction. That hormone drop affects your brain, your heart, your skin, and absolutely crucially for us today, your entire pelvic floor. So that drop in estrogen basically sets off a physical chain reaction. Less estrogen leads directly to vaginal dryness and a condition called genitourinary syndrome of menopause, or GSM. Basically, that means the thinning and drying out of those vaginal tissues. On top of that, you get reduced blood flow, which means less sensitivity, and a decrease in tissue elasticity. Put all that together and it creates a ton of friction and irritation, which leads to dyspareunia. That's just the medical term for painful sex. But here's what's really fascinating: the mind-body connection. Painful sex isn't strictly physical. When it hurts, your brain remembers. So the next time you even attempt intimacy, just the anticipation of that pain causes stress and anxiety. And what happens? You unconsciously tighten your pelvic muscles. You literally brace for the pain. And that bracing creates even more friction and tension, which makes the discomfort worse. It just turns into this vicious, self-perpetuating cycle. Right, moving on to section 2, the pelvic floor, muscles, and function. So your pelvic floor can react to menopause in 2 totally distinct ways. On one hand, you have hypotonicity. Think of it like a loose rope. The muscles lack coordination and tone, which can lead to a loss of sensation or even incontinence. But on the flip side, we have hypertonicity. This is when the muscles get excessively tight, which causes this sharp, burning pain right at the vaginal opening during penetration. Figuring out which specific type of dysfunction you're dealing with, that is the absolute key to stopping the pain. Okay, I want to pause for just a second here. Stay with me, because this next part, it honestly matters the most. We've talked about the biology, the thinning tissues, the tight muscles. If you're feeling a bit overwhelmed, take a breath. Understanding this anatomy is literally the key that unlocks the solution, because once we know what's physically causing the pain, we can actually go in and physically treat it. Which brings us perfectly to section 3, physiotherapy relief, restoring comfort. Let's look at how pelvic floor physiotherapy actually brings relief. And hey, this isn't some scary, intimidating medical procedure. It's a completely non-invasive path. Specialists follow a really structured journey, starting with a comprehensive assessment of your muscle tone. Then they might use manual therapy, which are just gentle techniques to release tension. After that, they bring in advanced tools like biofeedback and dilators to treat the absolute root cause of both weakness and tightness. Let's zoom in on one of those tools for a second. Biofeedback. It is incredibly empowering. It involves real-time monitoring of your pelvic floor muscles. So specialists at OVA Women's Health use this to show you exactly what your muscles are doing right there on a screen. You can literally watch yourself unconsciously clenching, and by seeing it, you learn how to actively release and regain control over your own body. It's a total game changer. And for women experiencing that sharp, burning pain at the vaginal opening, that hypertonicity we talked about, vaginal dilators are amazing. They are used in a super safe, paced way to gently stretch the muscles. But more importantly, they retrain your nervous system. By gradually exposing the tissues to insertion without any pain, it teaches your brain and your body that penetration is actually safe. It breaks that psychological cycle of pain right in its tracks. But listen, true relief? It takes a whole body approach. We have to look way beyond just the local muscles. Physiotherapists will educate you on exactly which long-lasting vaginal moisturizers and safe lubricants you need to fight off tissue dehydration. They also look at your posture, your body mechanics, and they'll teach you breathing techniques to regulate your nervous system. Because think about it, if your body is constantly stressed out, your pelvic floor is just going to hold on to all that tension. So here is the absolute most crucial takeaway. Early intervention matters. Please do not delay seeking help just because you think you have to live with it. Treating painful sex early doesn't just give you your intimacy back, it protects your long-term pelvic health. It literally helps prevent way more severe issues down the line, like urinary incontinence or, even pelvic organ prolapse. Moving into our final section. Section 4, Reclaiming Intimacy, Your Sexual Health. I want to be really clear here. You deserve a fulfilling, pain-free sex life at any age. Menopause absolutely does not mean closing the door on intimacy or your own physical comfort. If you are looking for the right kind of support, I highly recommend the specialists behind the clinical data in today's explainer. OVA Women's Health out in Burnaby, BC is a trusted clinic full of international experts in complex pelvic pain. It is a warm, completely judgment-free space where they will take your pain seriously from the very first minute. You have been patient long enough. You've probably suffered in silence, trying to manage all this on your own. Or maybe you've been turned away by doctors who, honestly, just don't have the specialized training to help you. Well, real, specialized relief is finally within reach, and it starts with simply acknowledging that you deserve to feel better. Taking action is super easy. Just scan the QR code right there on the screen to book your first consultation with OVA Women's Health. This isn't a rushed 10-minute visit. It's a thorough, unhurried appointment with compassionate experts who are actually going to listen to your story, assess what your body physically needs, and build a personalized plan to help get your life back. I'll leave you with this final thought. Are you ready to stop accepting pain as normal and finally reclaim your comfort and your intimacy? The biological changes of menopause, sure, they're inevitable, but suffering through them, that is a choice you simply no longer have to make. Take that first step today, reach out for specialist care, and start your journey back to a healthy, pain-free life. Thank you so much for joining me on this explainer.